This case will have a scalloped guide to mimic the bony contours in the upper maxilla so that you can give the patient an FP1 with natural papillae. We always start with the upper jaw. So we have the segmented jaw, the segmented teeth, and segmented alveoloplasty. The first thing that will happen in the surgery is to extract all the teeth. And once all the teeth have been extracted, it's time to use the index that will sit on native bone. You could see that we have 3 supports along with the alveoloplasty guide or the base guide. So you seat them together with magnets and then you go seat it on native bone. The path of insertion, we tell it to you, this is like anterior posterior, and you make sure that the legs on the index are seated on the bone. Once you have pinned the base guide, and then it's time to do the alveoloplasty. You could see that we have scalloped alveoloplasty guide marked with green. This will tells you to remove all this bone according to the guide that we have provided. Then you go place the implant placement guide. For this case, it's gonna be a straight multi-unit case except 2 implants in the premolar sides. So we gave you timing for Nobel BioCare. The timing on those implants is reflected on the implant placement guide and also on the base guide. So you can fine-tune your position without having to place the implant guide back if you needed to. You can go install the multi-units. And you could see the red ones are the angled multi-units. And in order not to waste time during the surgery, the ligating screw for the multi-unit, not the prosthetic screw, but the screw that ties it to the implant, you could see we gave you a red mark. So you just align your driver like this, and you align your driver like this, and voila, everything is perfect. And now, what you want to do is to do the conversion. So we gave you 2 copy FP1s, okay? So in case one breaks, etc., we just want you to give the patient a perfect smile the same day. So you have the carrier and the opposing bite. In one step, this is all magnetic, this is all have been like calculated exactly to the tolerances to everything. Just click it in place and then you go install your temporary cylinders. As you can see, for this case, we are going to pick up the last 4 temporary cylinders. The 2 anterior, we will not pick it up in the beginning. Once this prosthesis has been picked up and everything is okay, then you pick those 2 anterior alone and referencing to the already picked up multi-units and temporary cylinders. So you seat it into position and voila, you do your pickup through the occlusal. Because it's an FP1, there is really no room to do buccal holes. But before you use your temporary material, since the patient is edentulous in the lower jaw, you install this printed digital denture, which is an exact replica of the fixed prosthetics, and you have the bite indentations, and then you make sure the material sits in this position. You could see that the scalloped bone reduction along with the guide are exactly 3 millimeters away from the bottom of the FP1, the fixed prosthesis. Now the upper jaw has been converted and is ready. What you need to do now is to go to the lower jaw and you go do your flap and get the base guide along with the index and you seat it on native bone. You have multiple reference points and now you pin it and then voila, you take the index out and we give you green marks. These will bound where you will reduce bone. Distal to these green marks, you don't reduce the bone. This is your bone reduction and this is the bone piece. It represents the amount of bone to be reduced. It's really minimal. And then you go get your implant placement guide and seat it into position. You place the implants and all those are really parallel So it's time for you to install the straight multi-units. Now you have installed the temporary cylinders, and now you have seated your temporary cylinders, and then you go get one of the lower hybrids. You can see the buckle holes for the conversion. This is just a copy, so they are exact copies. You seat it into place, and then you seat it into position. And before you do your pickup through the buckle holes, you get finished immediate prosthesis in the upper jaw screwed, and then you align it to occlusion. You ask the patient to bite. Once the patient is in occlusion, then you start your conversion. And voila, suture the patient and everything is completed.